Thank you, ma'am. Now, it gives me immense pleasure to introduce our distinguished speaker for today. Dr. Abhinav Singh is a highly qualified physician specializing in interventional pain management, rehabilitation, and palliative care. He holds an MD from Christian Medical College, Vellore, and has further pursued a fellowship in interventional pain management as well as a fellowship in palliative medicine from CMC Vellore. Renowned for his holistic and patient-centered approach, he manages conditions such as arthritis, chronic back pain, sports injuries, neurological disorders, and cancer-related pain. His care model integrates advanced pain interventions with compassionate palliative support to enhance comfort, function, and quality of life. Dr. Singh is the only pain physician from Bihar to be a member of the International Association for the Study of Pain, IASP, and is actively associated with several international medical organizations. He also played a significant role in establishing Bihar's first cancer rehabilitation clinic, reflecting his commitment to advancing pain and rehabilitation care in India. We are truly honored to have such an accomplished expert amidst us today. Without further delay, I now respectfully invite Dr. Abhinav Singh to kindly come up on the stage and address the gathering.
Thanks for kind introduction. Although I have been introduced as a pain physician, and for that I have to undergo MBBS curriculum, then MD curriculum, lot of fellowship. But there is only one pain which I knew when I was a kid and a school going. And that pain was why I was having pain in abdomen while going to school. So that is something only I knew, no doctor can identify. So pain is something, can I have the cursor or something? My slides. Okay. So pain relief and lifestyle management, why we need this? Everyone, whether someone sitting in the front row or in the last row, I hope none of you will be having pain by the end of my speech. First thing, but one more thing is important is how all of you are sitting, how you are leading your life. Everything will determine about whether you are a student going for a fun, or studious student, or a fun-loving student. Everyone will be affected with the pain. Next, please. So what is this pain? Pain is something which is very vague, very subjective word. Everyone can say, I am having pain. Or going to this class is a pain. Attending the college is a pain. Attending this relative is a pain. But what is that pain? Pain no one can define. It is very vague and subjective. But it is something which we don't like, which we don't enjoy, which we can call it. And it can be physical because to our body, or it can be something psychological. So we have to always think in that term whether it is. This is a movie, if you all know, 3 Idiot. दोस्त को फेल हो जाए तो दुख होता है, अगर दोस्त टॉप कर जाए तो बहुत दुख होता है. So it is all about perception. So even we have to understand where we are having pain, why, how it is affecting our life. So to our body, or it can be something psychological. So we have to always think in that term whether it is. This is a movie, if you all know, 3 Idiot. दोस्त को फेल हो जाए तो दुख होता है, अगर दोस्त टॉप कर जाए तो बहुत दुख होता है. So it is all about perception. So even we have to understand where we are having pain, why, how it is affecting our life. So what are the types of pain? As I said, it can be physical, it can be psychological. When I'm saying it can be physical, I'm unable to see my slide. Sorry. When I'm saying, can I have that laptop here? Sure. Thank you. When I'm saying it is physical, mainly we consult doctor mainly for the physical pain. I had been hit by some object or something. I had not slept properly, then I had a pain, I have a headache. And everything has to be determined whether there is some pathology involved or some physiology involved in it. Okay. Sometimes when we are sitting in the library, we do tend to have headache. It can be because of some academic pressure. It can be because we are putting too much of a strain on our eyes. Our eyes power is not proper, or it needs to be checked, or there is a lot of a strain, or some eye related diseases are there that can also be there. Then another physical pain is menstrual pain in women. Menstrual pain, unfortunately, in our society, people think it is a pathological pain. No, it is a normal physiology. Every woman has to go through it. So it can never be called a pathological pain. But because of this type of pain, physical pain or unpleasant thing that happens during a period of time in every month in a woman's life, is because it leads to some change in the mood, change in the hormonal status, and change in the physical or the hormone chemical nature in the body. So these things has to be always kept in mind while deciding for the pain. Whether all menstrual pain needs any medication, we have to think on that terms also. Do we need? Yes. But how, when, or whether we don't need it. At some point of time, it gets exaggerated. This menstrual pain may get exaggerated if someone is going through some stress, some mental trauma, or some other chaos in their life, on the career or anything. So it can get. So that needs, every time we don't need a pain medicine, but at some point of time may be needed to just control and calm down. So which one medicine we can give if we are having doubt whether it is a menstrual pain is irritating? Answer is even I don't know. I cannot name a single medicine which should be given. Because, as I said, someone is sitting in the library and reading, a female, and she is having menstruation. But that pain is not necessary, it is because of a menstrual pain. It can be because of the other reason also. Her posture, her bone health, her muscle health, her way of sitting, her performance, her expectation from self that exams are nearby, I have to go and face an interview. All these things will determine. So it may be quite a coincidence that the lady is having a menstruation and she is having that pain, body pain. So it should never be clubbed together. That has to be always kept in mind. Now psychologically, I have not read whole year. Now 3 days onwards I have to go and appear in examination. What ma'am will say, what sir will say, they are going to scold, I am not going to scold, what will happen to my future, everything. And then another thing is psychology or a mood or anxiety, depression, which is quite common. And one of the common causes that is evolving nowadays for the psychological reason is our mobile. That is one of the common causes. Our AI. Now what is happening because of the AI that we have started taking them as our boss. Unfortunate part, it is supposed to be our servant, not the boss. Suppose ma'am gave me this pot, this flower. If I go and ask AI that whether I can chew this leaf and it will relieve my pain, and if I am a searcher, it may say yes. But a botanist who is doing a research on this plant is the best person to decide whether it should be eaten by a man or it should be taken only by animal, and if animal, which animal has that enzyme to digest it. One thing is common that whenever we are having a dengue, dengue platelets will come down. What is happening in our society? I am not an Ayurveda person, but what happens, what we are doing is everyone will go and eat the leaves of papaya. If what my medical science or what my understanding about this papaya is, platelets may not come up. It is just a coincidence. But this papaya leaf, if we can eat and digest, we would have used it as a sag. We are having palak sag, red sag, and the different types of sag we are having in our day. We have the enzyme to digest it. But during evolution, we cannot digest that plant leaf, so better to avoid it. Now regarding dengue, you will have low platelet, you will have back pain, body pain, and everything. So at that point of time, always remember one thing. The platelet is decreasing because it is fighting with your disease, that virus. Every viral infection, platelet will come down. If you, all of us were aware during the COVID, platelets were coming down. It is a natural phenomenon. Our body is capable enough. We have a stock of platelet which is fighting. The moment fight is over, the stock will be replaced on its own. So don't force yourself. So what is the treatment for them? What is the treatment if platelet is down? Don't worry. Don't search AI. Hydrate yourself. Keep yourself well hydrated. If your body is well hydrated, automatically most of the symptoms will subside. The virus grows always in the dehydrated body. It is a very good fertile land for a virus to grow. So we have to always keep this thing in mind. So anxiety, depression, it will be part and parcel of life. We have to accept it, cope with it, and don't get buzzed down with it, because it can also present as a pain. Okay, every parameter you will see is normal. Someone, you will find that, okay, his BP is high, his pulse rate is very high. All of us must be having an electronic BP machine in our home. The moment during examination time, just check it. So will you start taking medication for that? Do we need a medication, hypertensive, antihypertensive medication? So these things has to be calm down. Do some meditation, deep breathing exercises. You will calm down automatically. These type of pain. If the heart starts beating very fast, automatically there will be pain. So, but one thing we have to be careful. Sometimes pain in the heart may be because of the cardiac arrest. So what is happening nowadays because of the poor understanding of, or vague understanding, or AI guided understanding, is that even I am seeing patients who are having a heart attack and they are taking pantoprazole. Gas ho gaya. Every gas is not in your chest is not at all gastritis. Gas is a very vague term. People are saying that gas is in my head. That's why I am having headache. So they will go and take a pantoprazole. Please be careful while taking pantoprazole. Why I am saying be careful while taking pantoprazole? People are there in our society who are taking pantoprazole for years. It is never ever recommended. Because what pantoprazole does is, we have a stomach is secreting some acids. That acid is needed for digestion. Pantoprazole or omeprazole or whatever you are taking, that will go and decrease the secretion of that. So what is the solution for this gastritis or gastric pain? That gastric pain is simple. Eat something. Utilize that acid that is being secreted in our stomach. That's it. Don't go for fasting or a long duration of meal. For example, we will have a meal at 9 a.m. and then we will go home and have another snacks at 4 p.m. So this 6, 7, 8 hours, we are empty stomach, our food is being utilized. But our brain knows that we need energy. So it starts secreting acids in the stomach, but the stomach is not getting quality food. So all these things has to be always kept in mind while doing it. Now, menstrual health and the pain management, as I already said. When to seek medical health? Menstrual pain is a normal phenomenon. A woman is the best person to decide who is undergoing menstruation. When to seek it? When to seek, when I say that, when to seek is whether it is regular. Some of the female may have this menstruation in 24 days, 28 days, 30 days. Don't worry. It is a part of your body. Your body is responding. There is no hard and fast rule that one must have a menstruation at this stage. It is generally decided after once reaches puberty and 18 years. It becomes regularized. It may change after the pregnancy. So pregnancy is another factor which you have to keep in mind, because there is a 9-month gap of amenorrhea in which female does not have menstruation. So that change, be in touch with your gynecologist and obstetrician. She will be the best person to guide you. Don't panic, please. If you will start panic, this menstruation pain, you will have a generalized body pain. Now, whether lifestyle decides about it? Yes. When you are sleeping, how is your sleep cycle? How is your lifestyle? Are you having junk food or not? What type of behavior, what type of society you are in? What is the social condition? What is the environment of your home? Everything determines about the menstruation or menstrual pain. So as I said, do we need a pain medicine or is it safe? Be careful. All pain medicine, be careful. Pain medicine may give you immediate relief, but it is a double-edged sword. It is just like a stick which can be used by an old person to walk, or it can be used by an arrogant person to hit and hit someone's head. So it is always a double-edged. You should know when to use and when not to use, and that has to be always decided by your doctor, not by any actor. Because nowadays what is happening, actors are coming up with this medicine, that medicine, you take it. Although they are taking all their medicine supervised by a doctor, but they are marketing and for money making. So please be careful while taking any medicine. I've known many people taking aceclofenac, diclofenac every now and then for pain for years, especially older population when they are having knee pain and a back pain, which is very common. What happens if they are taking on their own? At some point of time, they land up in the nephrology department. Once your kidney is gone or any body organ is damaged, no one can replace it. No one. Whatever God has given us, we have to save it, preserve it. Once God's gift is destroyed, it is destroyed. I lost my vision, refraction, and now I have no option. My eyes cannot be corrected. My sight can be corrected. My eyes cannot be corrected. I am using spectacles. Most of us are using spectacles. Our vision can be rectified, not at all our eye. So same thing happens with the kidney or a bone or a muscle. If once gone, it is gone. No one can repair it. Everyone can claim to repair it just to fool you all. That's it. Nothing. Once gone, it is gone. Once liver is damaged. Once your pancreas is damaged, insulin is not secreted, you will be having diabetes. Diabetes can be controlled. It cannot be curable, non-curable. And now one question to every student: what percentage of disease is curable? Any guess? Sorry? Any wild guess? What percentage of disease is curable? Sorry? 40%. Okay. Any other guess? Huh? 30%. Any other wild guess? Huh? Sorry, speak. 10. Okay. Any other guess? Okay. Any other guess? Around 5%. That's it. 95% of disease can be controlled or can be managed. It cannot be completely cured. And those diseases which comes under this 5% are mostly the infectious diseases. Infection can be cured until unless it has damaged you. Now, I give you an example. Not all infections. For example, COVID. Most of us, not most, all of us are COVID survivors. We have survived COVID, and all of us were COVID infected. Whether found positive or negative, it is a very vague thing to talk. Now, you will find what we are seeing nowadays, that in the lungs, changes are there because of the COVID, which is not expected. So those damage will be there. So, for example, someone had tuberculosis in the childhood. That damage or that change will be there in adulthood also. If you will go through the CT scan or of those people, you will find those changes. So always remember one thing: once an organ is damaged or a body part is damaged, it is irreparable loss. So we have to be always preventive. We have to prevent everything. Keep our sight and everything in mind. So please be careful while taking any pain medicine. Any pain medicine. Another thing is, what is the role of paracetamol? Paracetamol, what is the use of paracetamol? Temperature reduce. Then? Sorry? Sorry? Fights the infectious disease. Okay. Okay. So most of the infectious diseases we are fighting on our own. Paracetamol, as most of us know, it is used to control our temperature and the fever. But it has a very good analgesic, as I said, that for pain control. Definitely it has a role. But what happens nowadays, that people take थोड़ा सा पैरासिटामोल खा लिए, थोड़ा सा ये दवा ले लिए, प्लीज रिमेंबर वन थिंग, एडिक्वेट डोज मैटर्स. Low dose is equal to zero dose, high dose is a toxic dose. So proper dosing of paracetamol is necessary. For example, some people take paracetamol mixed with some other medicine. I don't want to name a brand or anything like that, but that mixture is available. Please be careful. If we can manage any pain with one molecule, why to go for another molecule? So be careful. While it has to be always, rule book says, optimize a pain control with a single medicine. If you are not able to, once we reach the optimum dose of that medicine, then add any other medicine. What is happening nowadays in the market, and because of this social media, people are eating every now and then. Companies are there to sell their product. Nothing. They are there for profit making. We have to be cautious whether we are injuring our liver. Some point of time you will find, if you go and read your AI, side effect of paracetamol, you will find it is leading to your liver damage. Many of you will not take liver. No. We should take aceclofenac or diclofenac because it does not mention. But you will search aceclofenac damages liver. You will find that no, not much, because it has nephrotoxic effect. Kidney, it damages more of a kidney. But if taken in proper dose, any medication does not have a side effect. Some of us have in the society that allopathic medicine causes this side effect, that side effect. If taken in a proper dose, no allopathic medicine has any side effect. If inadequate dose it is taken, yes, definitely you will be having side effect. If low dose is taken, it is having side effect because of the disease. If taken in high dose, it quite possible it is because of the medicine. So pain medicine, is it safe? Be careful. Always be in touch with your doctor. Especially your family physician, whoever is seeing you for a long time, he knows what are the complications of pain may come. So posture and musculoskeletal health, how we are sitting on our chair, how we are walking, how we are talking, everything will decide about our life. So back pain is quite common among students and the teaching fraternity. The reason is our posture and how we are extending. For example, nowadays mostly it is digital. Earlier it used to be the blackboard. Teachers used to write for at least 40-45 minutes on the blackboard. So by the end of the day, if they have to take 2-3 classes, they will have pain in their fingers, in their elbow and shoulder. They will have. And at some point of time, by the time they reach their home in the night, they will have cramps in their leg. In the middle of the night, they will wake up and they will have cramps. So this lifestyle of a teacher is deciding what type of pain and where he is having. So other thing is, now there is a change in generation from millennium to Gen Z. Okay, so there is shift in generation, but there is also shift in the site of pain. For example, in a women. Earlier, women in our society, women are boss of the kitchen. They take all the calls. Whoever you are, whatever you are in this male-dominated society, you can't enter the kitchen without their permission and do whatever you wish. You will get a scolding from your mother to wife to daughter, everyone. In one voice, they will say you have made a mess in the kitchen. Now earlier, Gen Millennium used to have pain in their wrist. Okay? Why? Cooking, different type of bhujias and all. Now Gen Z is not having that, or this prevalence of this type of pain is decreasing in Gen Z because they are advanced generation, and that has now shifted to their thumb. Most of the time they are busy in their mobile, reel, Swiggy it, okay, Zomato. So this kitchen is now in their thumb. So wrist work has decreased. So see, as we do more of the reel or unfortunately, we are now in a digital world and everything will be determined by our computer and mobile. We are dependent on it. We have to accept it. But we have to be careful. Everything has a side effect. Drug has a side effect. So digital world has a side effect. We have to cope with it and we have to find a solution to it. Now, another thing is when women is pregnant and post-pregnancy there will be a pain or musculoskeletal changes. The reason is in the 9 months when a female is pregnancy, there is a lot of hormonal changes happening, or just after the pregnancy, once a postpartum changes are there, that there will be significant decrease in the hormone. And because the women who was feeding a child also now has to take care of only one person. Earlier it was two person. So that change in the circulation, blood circulation will also change, body weight will change, muscle mass will change. So everything. And also after the postpartum, female is breastfeeding. So her nutritional level will again change. So these pains do erupt in one form or the other. Another thing is, if a newborn baby is there, the mother will not be having a proper sleep. Baby will be awake most of the time in the night. Slowly, baby's sleep cycle takes time to develop. So that point has to be care of. A lady is not getting a proper sleep because in the daytime she is busy with the household work or her office work. Night time she has to be there. Aya is not going to sleep with the baby in the night. So that point has to be there. So everything is pain is not only because someone says, okay, just after pregnancy, it happens to everyone. Because this sleep cycle, everything, mental status, depression, mood swing, everything will come after the delivery of the baby. Nutritional compromise. So that has to be taken care of. So posture is an important thing for students to take care of in their mind, because in long run, this is the posture you are sitting in the class. Now you will be sitting in the office or wherever, or in the car or in the scooty. Everything will be there. So lifestyle factors that affects the pain. The quality of purse. Lot of companies in the mall are selling it. What is there in the female's purse, I am least bothered. But how you are holding it, definitely as a pain physician, it bothers me. Why? Most of us are right-handed. And someone is having a big purse or some people have a small purse. How you are holding and where you are holding. Few of us have a habit of holding on the shoulder. Few of us have holding on our forearm. So that weight of how long you are holding it, that will determine your pain in the upper limb also. Because if suppose someone is holding in the forearm and roaming around and walking around, or on the back, okay, one-sided. Mostly it is one-sided. It is a natural thing. We are one side dominant. So it will be one side. As per the comfort, either on the left or right. You will be roaming all around. Now see, if a big purse is on your shoulder or on one side of the body, the weight shifts. The weight is, our body is symmetrically made, but weight will be shifting to one side. So other side of the body will try to bring it to the next side. So that will again lead to a pain. So whenever you are holding a purse, please be careful. Have something which is must. Size of the purse will determine how you are holding. When you are holding, some people walk with a to and fro movement of the arm, everything. So keep changing. So keep changing the position of the bag in your upper limb, in the limbs. Whenever possible, stretch your muscles which you are using. Simple is this stretching. This will work. This much will be more than enough. Another is heel. How many of you are wearing heel? Fortunately, the rule is here everyone has to come barefoot in this room. It's a good rule, I think, because at least our fit is relieved as of now, because our feet is in a natural position, standing with a foot on the ground. But this fashion statement, which most of us follow, high heel, the hoodie. So now what happens if you are wearing a high heel? See, first look into the tip or the toe region. It is just narrowed down. What happens to the circulation or blood circulation of our toes? It is compromised now. One toe is above the other toe. So that will compromise, and at the end of the day, if someone is wearing this type of shoe or pointed shoe, that will be a cause of a pain. So if for that type of pain, what to do? Simple, change your shoe, footwear. That much will be more than enough. Relax your fingers, because you are not allowing proper blood circulation to your toes. That much is enough. Use it, move it, that's it. Another thing is heel. When you are wearing this high heel, pencil heel, what are multiple heels are there. So better known to you all, because I am not a fan of it. But if you are using that high heel or any type of heel, your body posture is changing all the time. First thing, our now normal gait, whenever we are moving, we put our toes or forefoot and then we raise our heel and then we move forward. But in this case, that is already compromised. Our heel is already raised. It is never coming down. So that is not a natural process or evolutionary process through which our heel should work while walking. Although one may look taller, but this is having a detrimental effect. So this type of pain called plantar fasciitis or heel pain is very common in all those who are not using proper footwear. What is the definition of a proper footwear? That will be again come. Whenever you are buying a footwear, best thing to look is the broadest part of your foot should be the broadest part, equal to the broadest part of the footwear. That much. At no point of time, one toe should overlap the other toe while you are wearing. That should be purpose of trial, not looking into the mirror. That much if you will do, this pain in the heel will start coming down or start subsiding. This plantar fasciitis, because again, the moment blood supply of our heel or leg is compromised, you will have pain. So this thing has to be kept in mind. Again, the dressing, jeans or tight fitting dresses that one is wearing. Again, your muscles will be constricted for a longer duration. So if that happens, again, end of the day, you will have a compromised blood supply, pain, cramps, everything will come up. Stress and pain, as I said, has a strong connection. As I said, every child has a pain abdomen because of the stress, homework not done or examination and everything. So everyone, all of us had at some point of time that type of pains, that type of stress, anxiety because of the career, because of the classes, because of the performance of our student, or students not happy with the teacher. It is all-sided, two-sided, their workplace pressure. So we have to learn to cope with it. Best way to cope is, if you are in a stress, do a deep breathing exercise. That's it. Go for a walk, divert your attention. For 5 minutes, go do something unusual which you are not doing. That much will be very much helpful to you. Nutrition. Is this nutrition beneficial? Swiggy, Zomato, which is providing, chal bhai party karte hain, so we will have party. This is called our party in our society. How many of you had sattu this year, 2026? How many of had sattu? Oh, few. Oh, that. Hey, it is to help satisfy me that, okay, you guys are good person. I can't believe. Most of you, more than 50% had sattu. Okay. The best nutrition or best diet is our local diet or a seasonal diet which we are having, and it differs from area to area. In Bihar, it is completely different. In Tamil Nadu, it is different. In Kerala, it will be different because climate is different. If you go and don't have rasam and try to survive in South India, it will be very difficult. Why rasam? I am saying rasam, it has evolved. Why rasam? Rasam has lot of salt. When you are dehydrated and having sunburn and all, salt loss will be there. That leads to cramps and other complications of dehydration. Have rasam. It will store water in you. And best thing is to be hydrated. Always remember, a good muscle mass or good quality muscles is always a hydrated muscle. When I say hydrated, what does it mean? How do you find whether you are hydrated or not hydrated? Check the color of your urine. If it is yellow, you are not hydrated. Yellow color, your AI will say the yellow color, you will find what disease causes yellowishness of urine. Your AI will say, give you a big list of disease. Then you will start saying this doctor who was called by Department of Botany is a fool. He's saying you are dehydrated. 75% of patients are dehydrated, that's why having it. First and foremost thing that should come to your mind the moment you see that urine color is yellow is dehydration. That adequate water intake is not there in your body. Please keep yourself well hydrated with normal water, not cold drinks. Please keep this thing in mind and always remember the local diet or eat something every 2-3 hours. Fruits, raw thing, sprouts, salads, they are very good nutritious thing. Okay. So exercise and movement therapy. So do you agree? So all of you are planning to join gym? Sorry? No. Yes. Yes. Okay. Gym is just a superficial place to satisfy yourself. Invest your money. Until unless you want to be planning to be a model in the future, or having some issues for which gym trainer is needed. Otherwise, best exercise for you. Botany department is on this floor, ground floor. Okay, so all of you should stop using the lift. That's it. Use the stairs. Use the stairs. Stay fit. Okay, you have such a beautiful campus. Roam around whenever you get time. Stairs are to be used, not to sit and gossip. Remember this thing. Please start moving. Please mobilize yourself. How many of you can do 10 times sit-ups? Sit down and stand up. Are you doing it daily? So do it daily all your life, because earlier it was part of our lifestyle. If you go to villages, it was our lifestyle. We used to sit and eat. Now we are having dining table, sofas and everywhere. So this lifestyle is why I am saying this. If you do that, your knee health will be good. Now this knee, osteoarthritis of knee is coming up because of this change in lifestyle. We have started putting on weight. Earlier, now everything is by vacuum cleaner and washing machine. Earlier we have to sit down and clean our clothes. So that was a very good exercise for ourselves. So for exercises, only thing is you no need to go to gym. If you are interested in keeping yourself extra fit, just go ahead and do it. But make it a part of your lifestyle. Exercise, a special training, I am spending 1 hour on exercise. No, make it a part of your lifestyle. I give you an example. One lady I was seeing, she was known diabetic, and she was on a low dose of anti-diabetic medicine, and she was from a business family. What she used to do, husband and son used to sit in the shop. So from 4 or 5 kilometers, she used to bring lunch for them. But I told her, why don't you come walking with the lunch? She said, kya kahegi duniya? I said, try for some time, I will save that money. So because they are from the business class, they know what is the importance of money. So she started doing it, and within 6 months, I stopped the medicine for diabetes. So if we make it a part of our life, come out of this status symbol, बड़े लगेंगे, बड़े दिखेंगे और क्या कहेगी दुनिया, it will definitely help you in future, and it is always a long-term investment on your body. Mental health and support system, definitely it is needed. Because everything is processed by our brain. Because pain tolerance for anyone, for someone who is from a labor class, and for him pain tolerance is far more than us, because every day he is pulling out, he is lifting weight for his survival. So that person's, if even you go and hit, nothing will happen. If someone comes and hit me, I may be in the hospital. So this thing has to be always kept in mind, because it is the mentality and it is the physical health. Know how to keep ourselves mentally fit. The best way is to talk with someone, your near and dear one, and ventilate out. If no one is there, come meet your doctor, meet your psychologist. Tell, I want to ventilate out. Just ventilating out will make you feel relaxed. So always keep this thing in mind. So when to seek medical help? When you have enough money in your pocket. When you think that now there is something that is troubling with my day-to-day activity. Because of this pain, I am not able to go to the class. Because of this pain, I missed my party. I missed my friends. I cannot go and move around. So definitely you need to take a medical help to find out whether there is any pathology. Sometimes what happens, as I told you the example of this gastritis and heart attack, same thing happens with all types of pain. One more thing, in a female, what happens that pain comes earlier than a male. For example, if a knee pain or osteoarthritis in a male will come at age of 70, in a female it will come at the age of 60. The reason is the change in the hormonal level. The moment a woman reaches menopause, there is a drastic decrease in the estrogen, and estrogen is a very good hormone for a good bone health. Okay. So another option is creating a pain-friendly campus. Already it is there, which once I entered in, I found it that all of you can roam around, use the stairs, good park, good field. So spend some time at least inside the campus. It is safe and it is a healthy one. So the conclusion is pain should not be ignored. It should be discussed. If necessary, take a professional help. Otherwise, if able to manage, well and good. Lifestyle has a major role to play, how you sit, how you stand, how you talk, and it has to be there. And movement is always a medicine. Keep moving yourself. Because nowadays you are getting a good quality of chairs which will work like a jhula. So avoid it. If possible, go to the traditional, that wooden one with a straight back, sit over there. It will improve your posture. And stress management, no doubt, it is essential. Stress can be because of anything, performance in the class, to career, to life, to family, society, everywhere. It can be anything. And early help always prevents complication. This is one of my YouTube channel on which I keep posting about my pain thing, which I have started recently. Okay, so if there is any question, definitely I will love to reply. And one more thing about, if anyone thinks that I am a feminist, I don't mind. And that is best cosmetic in the world is water, nothing else. It will bring more glow and make your life pain-free than any cosmetic cream in the world. So please keep this thing in mind. Thank you. So, any question? Yes.
Good afternoon, sir. So my question is that in early stage, how we understand the difference between normal headache and migration,
Okay.
and how migraine this is, and what should be recommendation lifestyle change for migration patient?
Okay. Migraine, first thing, migraine is always, there will be exaggerating factor which will trigger the migraine. Okay. Headache is a very vague term. It can be any part of the head. It can be throbbing headache. It can be because of hypertension. It can be because of diabetes. It can be because of some refractive error. It can be because of the glaucoma, or it can be because of the sinusitis, allergic rhinitis. So, or even it can be because of the fever, viral fever, or anything, or any type of infection. You can sit down. So this thing has to be, it is a very vague, it is a big umbrella under which all these things comes, out of which one is the migraine. Okay. Now the moment this question of migraine starts, we call it anything as a migraine. If someone is having a headache persistently, we call it as migraine in a layman's language. In medical term, no, it is not there. There will be always an exaggerating factor or something that will trigger the migraine. For example, a most common thing is when someone goes out into the sun, it may trigger. So you have to find out if that is triggering it, sort out that trigger factor. That is the only long-term treatment. And if some people have change in the retina or change in the pupil or the eye, because the moment one goes from the dark room to a lighted room, there is change in the pupil. So that can also exaggerate it. So one has to find out what is triggering that migraine and how to manage that migraine. What I advise to people, one of the common causes is this light, bright sunlight. So what I advise, if they are using spectacles, have a photochromatic spectacles. So the moment you are in the light, you can, it will help you out, help you come out of it. And always thing is, what are the symptoms? Few people after some point of time start getting this aura. Now I will have the pain. So that aura has to be always taken care of. At that point of time, it is better to be in consultation with your pain physician, take a medicine. Because the moment a pain is at its peak, it has to subside on its own. But before it starts leaping up, medicine will definitely help. So always find out the trigger factor. It will be localized to one part of the brain. right or the left. It depends from person to person or the occipital region. So that will be always there.
So sometimes the gas problem is converted into a stomach pain, and when it gets severe, it also gets converted into chest pain. So people used to take medicines like they take, or simple medicine, the ACs also they take. So if it is a good thing, or how we can differentiate between a cardiac arrest or a heart attack it is, or it's just a gas problem.
Okay. So, gas, again, as I say, it is a very vague word which we tend to call gas if we don't understand anything. Gas, suppose any disease, as you said, it is from the stomach pain, it changes into chest pain and it gets exaggerated. Whenever a disease or any symptom is getting exaggerated, it is not coming under control, take opinion of your physician. First thing, because gastritis is something related to your stomach or intestine, GI tract. Okay, so it will come as a burping, it can come as a farting, or it can come as some pain abdomen. So everything cannot be gas. And I think what the best treatment for gas is eat something. That's it. Eat some salads or some bhunja or something like that, or some fruits, whichever suits you. That's it. Medication, long-term medication is never recommended. If someone is having gastritis, most common cause is the lifestyle. Now, as you said, how to differentiate whether it is because of the gastritis or a heart pain. Heart is on our left side. Okay, so it will be a pain somewhere in the fourth, near the nipple. Okay, whether it is a male, female does not matter. And then it will radiate to the back side on the left upper limb. Radiating is, it will patient or someone will be having complain that it is something is starting from here and going to the upper limb. It can go to the scapula or the back side also. So that has to be taken care of. Another thing is, whenever you are having such type of doubt, meet your physician. Any point of time, excessive sweating will be there if it is a heart attack. Irritability, restlessness, everything will be there. For gastritis, nothing like that. So that has to be kept in mind.
So my question is that someone who goes through severe menstrual cramps every month on a regular basis, and he's advised to take painkillers such as lifetyle. Is it safe to take? Because I also have heard about it that it leads to kidney failure or something, and it's not just about 1 month. So is it still safe to take it?
It depends who has advised. If your gynecologist advised, definitely 3-4 days of meftral spas won't lead to kidney damage. Maximum 5 days. Most of the women have this menstrual cramps, so maximum of 5 days, not more than that. 5 days it won't harm. But there are other modalities which you should also try. Try hot water bag. Try to calm yourself down. Try to avoid the stressors that is there. A stressor or any psychological issues or thing will exaggerate it. So try to do the deep breathing exercises. Relax your lower abdomen muscles. Avoid constipation. These things will definitely help. And definitely, if your gynecologist or obstetrician has advised, definitely you should take it. 4-5 days, I don't think it will harm your kidney. But if taken continuously for 4-5 years, definitely it is going to harm.
So I wanted to ask, as someone who has regular knee pain and back pain, and because of situation they cannot avoid moving, so what will be your advice for them?
So, okay, good question. Just sit down. So one thing is, I will tell you in generalization that most of us tend to get our vitamin D and uric acid checked for these type of pain. So first thing, remember, all joint pains are not because of the raised uric acid. Even if it is raised, it can be because of your diet. If you are taking a lot of non-vegetarian food or protein, it will increase your uric acid. So uric acid level should not be considered. Vitamin D, another thing is, because of our lifestyle has changed, most of the time we are under the roof. So vitamin D deficiency is there, and it is unfortunate that in India, when we are seeing sun around the year, we are having it. Foreigners are coming to India to just have a sun bath. So we should expose ourselves to the sun. First thing, our diet also determines it. This junk food definitely will not be beneficial. Sprouts and all, cashew nuts and all this will help in building up with calcium rich diet. Milk and milk product, they are very good things. So have it. Another cause for students having this back pain and the knee pain is their lifestyle. Most of the time you are sitting. If you start doing aerobic exercises, it will definitely help you come out of it. Even if that does not help, definitely you need to take opinion of your physician. What aerobic exercises? It can be skipping, it can be some basketball, badminton, or anything game like that. Even if you don't want to play game, you want to dance, definitely dance is a very good thing. Zumba, join the classes, or if you want to do on your own. Or else, even if you don't want to, you want to party, go for the marriage party and dance, dance, dance. Bharat dance, do it. No one is going to see whether your steps are proper or not. So lifestyle modification, move your hip, move your joint, so that the best benefit of moving all your muscles is blood circulation will improve. So the blood circulation, what happens, there are chemicals secreted at the site of pain. That blood circulation, improved blood circulation will drain off that pain, the chemicals, that is prostaglandin and all. So automatically pain will subside. Plank, you can do plank exercises also for the back.
Any other one? Questions? Done? Question है? हाँ?
How many of you are having pain now? Okay.
Like body stretching pain and in back sometimes it happens. Because maybe of the posture only.
See, our natural tendency is not to go for any change. Okay, all of us tends to avoid our change. We are even comfortable with our old chair and table which we had been using since childhood. Although can be given a sophisticated table, we won't be that comfortable. It is a natural tendency. It is natural tendency with our body, with our muscle also, to remain in that state. So if it is in a contracted state and relaxed state, all of a sudden you are telling it to work something, it will try to avoid, and that comes as a pain. So best thing is to do some exercises which involves all your muscles. The moment you start doing it, it should subside and it will help. So that is the only treatment. Once in a while it is happening because that group of muscle has not been used for a long time or not stressed to optimum for a long time. Thank you.